Have you ever wondered if you might have serotonin syndrome? You probably don't, but I'm a pharmacist at Poison Control, and let's talk about it. Now, maybe you've Googled serotonin syndrome before and convinced yourself that you have it, or you're just wondering what it is, but it occurs after taking too much of one or multiple serotonergic medications, or medications that increase the amount of serotonin, a brain chemical, in your brain. The presence of true full-blown serotonin syndrome is actually rare and maybe even underdiagnosed, but it's more common just to have too much serotonin going on than to actually have the full serotonin syndrome, which we in practice classify using Hunter's criteria. When you think of serotonin-containing medications, the first one everybody thinks of is the SSRIs, so things like citalopram, sertraline, venlafaxine, and things like that. But there are several medications that also have serotonergic either chemical structures or backbones or interacting components where they can increase your exposure to serotonin. The most common one that we get questions about and that we actually see in practice is dextromethorphan, which is the over-the-counter cough suppressant that you find in Robitussin. Some other medications that might put you at risk for this include tramadol, fentanyl, ondansetron, triazidone, meperidine, selegiline, and linezolid. There are also several street drugs that could put you at risk for this as well. Symptoms of too much serotonin include things like confusion or restlessness. You may feel like your muscles are tight and can't relax properly. You may have high fevers. You may feel like you have heart palpitations or dizziness, and it can even lead to things like seizures. Most of the time, holding the medication or medications causing this is enough to give your body time to get rid of the excess serotonin, but there are some cases that are more serious that require medical intervention. These would be things like high persistent fevers, really bad muscle rigidity, or of course seizures. The best way to minimize your risk for serotonin syndrome and serotonergic excess is to avoid high doses of serotonin-containing medications and also minimize multiple serotonin medications that are being taken at one time, which is my next point, is that you should always talk to your doctor or pharmacist before you start a new medication because there could be these potential drug interactions and they can potentially be life-threatening if you don't recognize the symptoms quickly or they go untreated. So as always, call us here at Poison Control with questions at 1-800-222-1222 and share it with your friends.